Good morning, friends. Journey in the field of implantology. I have started practicing conventional implants some 8 years back. I've done few courses and started practicing conventional implants. The main problem with the conventional implant in my practice was the waiting period for the patients. They have to wait for 4 to 5 months, sometimes 7 to 8 months also, when there is a need of membrane graft and PRF, all those things. So many other advanced techniques were needed for the implant to get osseointegrated. So I was doing the conventional implants. Later I got introduced to basal implantology by one of my friend from North India, that is Vinay Mishra. So he uses a Bonankar implants. He's the owner. So he told me to start doing a basal implants. He's not a doctor, he's a supplier, but still I got many inputs from him. So I started practicing basal implants. My first case was a full mouth case. So before starting the full mouth case, I went for a workshop in Pune. I stayed there for 2 days, and then after coming back, my first case was the full mouth case in my friend clinic in RPC Road, Vijayanagar. So it came out very well. Advantages of basal implants here is that we are going to place the implants deep, that is below the cancellous bone, so into the cortical bone, that is the T2 bone, where the implant will engage very well, and it's an infection free zone. This area D2 bone, where below the cancellous bone, is 99% infection free zone. Most of the time, if you can place properly the implant will not fail. So you have to do good osteotomy, place the implant. So that's how I started doing corticobasal implants. I have done 3 to 4 workshops also. So I do one-to-one interaction teaching, that is one-to-one interaction workshop. So here, for all the doctors who attend my workshops are in one-to-one interaction teaching, I'll give, most of the time I'll try to give full mouth case where they can learn all the techniques, that is placing the implant in the nasal floor, placing the implant in the anterior mandible, placing the implant in the pterygoid plates, placing the implant in the atrophied maxillary posterior region, where the floor of the maxillary sinus is very close to the crust. So how to place, and also how to do the nerve bypass in the lower posteriors by engaging in the mylohyoid ridge. So how to do the buccal bypass, lingual bypass in the lower posterior regions. So all these techniques can be covered in the full mouth case. So I usually give full mouth case whenever I do teaching. So how much ever the workshops you attend, you have to try practicing yourself. So you can attend many workshops that will give you more exposure, but you have to start practicing the basal implants in your clinic. Start with the simple cases like placing the implant in the lower anteriors, upper anteriors. Lower anteriors is the safest zone because there is not much of anatomical structures of importance there. Upper anteriors also you can place, so with proper angulation and perforating the nasal spine area. So in that way you can start the simple cases first. Then you can shift to the upper full arch or the lower full arch or the lower complete full mouth rehabilitation cases you can do. Here in basal implantology, the technique is osteofixation or osteomodulation, wherein you're going to engage the implant in the native bone, that is a D2 bone. So if you get good stability and torque, you can go ahead and do the prosthetic procedure. The whole treatment usually, if your lab supports, you can finish it in 72 hours or maximum of 4 to 5 days. Here in basal implantology or corticobasal implantology, the advantage for the patient is that not much of blood loss. Patient will be at ease while doing the surgery because there is no flap opening, no suturing, no graft. So all these additional things will not be there in basal implantology. Only thing is, it's a technique sensitive. You have to be thorough with the anatomical structures while placing the implants, especially in the lower posterior region where the mandibular canal runs, and also the area of the mental foramen area, that is the premolar region, and in the upper you have to be careful with the maxillary sinus. In the posterior pterygoids, it's a blind technique. You can place up to 34-35 mm length of implant there. So usually In basal implantology, the main implants we use is BCS, that is we call it as bicortical screws, and the compressive implants also we use, that is a rough surface, same as the conventional one. So the BCS, bicortical screws, is the choice. That is the main choice we place. You can place this BCS in all the areas, anterior, posterior, wherever bone is available. Bicortical screws you can engage in the lower mandible and also in the upper maxillary region also. So depends on the type of case and the type of bone available. So in this way, the time period which is needed for the completion of the treatment will be maximum of 5 to 7 days. You can give the processes also, so that patient will be happy because the treatment got completed in the short period, and they can start eating the day after completion of your fixation of the processes. So all these are the advantages for the patient. Okay, so comparing to conventional implants, I'm not against conventional implants. I was a conventional implant practitioner. So here in corticobasal implantology, if you can engage properly, if you can do the prosthetic part well, patient will have good life, your processes will have good life. Okay, so everyone should start practicing corticobasal implants. The only thing is this is technique sensitive, so more than workshops, you please attend or learn things from the doctor who teaches clinical aspect, I mean the chair side. So you have to see the cases, you start doing the cases in your clinic, simple cases you start, then only you will get the confidence to do the work. So everyone should start practicing basal implants. So if any queries, if anything you want, any help you want to learn from me, please call me on my mobile number or visit my YouTube channel Venkatesh Murthy 09. I have got some 230 videos related to implants only, that is mainly